Hey everyone, today I'm going to talk about prior authorization with Original Medicare because this is a really big deal. It was just announced by CMS, Centers for Medicare and Medicaid Services, just this past week. And I'm looking at an article right now that I'm going to go through and explain what this is and how it's going to work. Original Medicare historically has had no prior authorization. It's been just this completely open book. But something kind of crazy has happened in the last few weeks. Well, it didn't happen in the last few weeks, but it was revealed. There has been major Medicare fraud. We've known this. We have known for years that there were people taking advantage of the system, but this fraud was in the tens of billions of dollars, and it's centered around easy ways for these fraudsters to get money from Medicare. And some of these fraudsters were foreign entities, including Russian entities that had purchased legitimate practices in the United States. They used those legitimate medical practices and medical device companies to defraud the federal government from billions of dollars. So, with that framework of what recently happened in mind, the government came out with what they're calling the WISER model. It stands for Wasteful and Inappropriate Service Reduction. And this enables CMS and Medicare to now have some prior authorizations. In fact, for 17 services, they're going to have prior authorizations in 6 states as a pilot program. The 6 states are New Jersey, Ohio, Oklahoma, Texas, Arizona, and Washington. So in those 6 states, starting next year, there will be prior authorization for 17 services that CMS says are, quote, vulnerable to fraud, waste, and abuse. So with all of this negative talk about prior authorizations in Medicare Advantage plans, the truth is all insurance uses them, not just Medicare Advantage, group plans, individual plans, Obamacare plans, and now Medicare, because it is the only way to prevent fraud in some cases. And it also is a way to prevent overutilization for things that are not necessary. We have to acknowledge that, and hopefully it's not you, but there are people that overutilize the system. Now, as I say that, make sure that you get the help that you need, that you're seeing your doctor when you're supposed to. But there are some people that are rushing to the ER when they have a cold. When they sneeze, they go on Google, or nowadays, they chat GPT it, and it says you're going to die, right? So there are people that overuse the system. They overuse it, they abuse it. The WISER model, the idea is let's take the 17 most vulnerable things that we see right now for fraud, waste, and abuse, and we are going to have prior authorization for them. So let's talk about what these 17 things are. Okay, this is going to be really fun. I'm going to read these 17 things, and then you can put in the comments how well I did because they're not easy to read. Electrical nerve stimulators, sacral nerve stimulation for urinary incontinence, phrenic nerve stimulator, deep brain stimulator for essential tumor and Parkinson's disease, vagus nerve stimulator, and induced lesions of nerve tracts, epidural steroid injections for pain management, including facet joint injections, percutaneous vertebral augmentation PVA for vertebral compression fracture, cervical fusion, arthroscopic lavage and arthroscopic debridement for osteoarthritic knee. Say that 10 times in a row fast. Hypoglossal nerve stimulation for obstructive sleep apnea, incontinence control devices, diagnosis and treatment of impotence, percutaneous image-guided lumbar decompression for spinal stenosis, and skin and tissue substitutes, application for bioengineered skin substitutes for lower extremities in chronic non-healing wounds, and wound application of cellular and or tissue-based products, CTPs, in the lower extremities. So they're talking about wound grafts and allografts. So those are the 17 things that will require prior authorization in those states. And I just want to give kind of a reaction to this and share with you my thoughts. I think that this was bound to happen at some point, and I'm surprised it hasn't happened already, prior authorization in Original Medicare, because the amount of Medicare fraud that is happening is extreme. I'll give you an example. Many years ago, I was sitting in someone's home, and I was helping them to make a choice about their Medicare insurance. And this woman said, well, you know what? I really love my medical supply company. I don't want to lose them. I need you to make sure. I love this new insurance that you're telling me about. It's going to save me a lot of money on my prescriptions. This is great. But I need to still be able to use this medical device company because I love them. And I said, well, that's great. Let's look and let's find out. Let's make sure that you can still use them in your new insurance. Why do you love them so much? And she said, oh, I love them because the other day, for example, for my sleep apnea, I ordered a mask. And they are so wonderful. They just anticipate my needs. I ordered a mask, but in addition to a mask, they sent me cables, a new machine, and all of the other things, and an additional mask. And I got this whole box that came in the mail, and all I had asked for was just the mask, and they anticipated what I needed. And I sat there for a moment, looking at this box of all these medical supplies that are being billed to Medicare. And I said, this is fraud. This company is not anticipating your needs. They're making sure that their financial needs are met, and they're defrauding the government. Prior authorization is meant to prevent some of those things. It's a pilot program. It's only, these 17 things that are very expensive and are prone to fraud, waste, and abuse. But what is going to come in the future? I guarantee prior authorization in Medicare is going to eventually be similar to prior authorization in all other types of health insurance. And it should have happened earlier, honestly, because so much fraud is happening and so much has happened, as evidenced by this Russian crime ring that's taken $10 billion out of the already vulnerable Medicare fund. So yes, I think it's coming. I think it will be the norm. And the days when you stayed with original Medicare because you didn't want to have prior authorizations instead of going with a Medicare Advantage plan, I think that those are going to be over in the future. But with that said, there is a lot of work being done around prior authorizations that hopefully will make them better and will make sure that actual needs are always met above the needs of investors and private equity and all of these in the for-profit companies that run health insurance. I think it's a very good thing because I have seen the fraud. Now, we have to be careful and make sure it doesn't go too far, that the people who need services and need care always receive it, but we also need to protect ourselves from criminal enterprises as large as a Russian crime ring or as small as an unscrupulous doctor in your neighborhood. All right, that's all for prior authorizations, but there is another big thing happening in Medicare right now, and it is the big, beautiful bill. And I've made a video about how that is going to affect you and affect both your Social Security, your Medicare, etc. So watch that next right over here.